Hi, I'm Anthony from Technique Peaks. So today I want to look at some dorsiflexion mobs. So you can either do this technique just like a regular mobilization, or you can do a mobilization with movement. So what we're going to have here is the patient position in a half kneeling position. We're going to take a mobilization belt. You're positioning it around the mid-calf. So the mobilization belt allows for increased tibial roll while we're doing this mobilization. So what we're going to do is position our hands like we would for dorsiflexion mobilization. And if we want to, give a little pressure with the mobilization belt and provide that posterior to anterior force, or sorry, anterior to posterior force for mobilization. And if we want the patient to help with this movement, what we could have them to do is try and bring that knee over your toes. And as I do so, keep the tension on the band, providing that anterior to posterior force at the talus, and then you can relax. I'm going to do a couple of sets of these to help increase dorsiflexion, and then relax. So I hope that helped, and this is Anthony from Technique Peaks.